Hi guys, hope all is well. Just taking a little break from studying. I was recently asked a question with regards to the difficulties of dentistry and medicine, for instance, which is harder. So the question is dentistry harder than medicine? My answer is not simple at all. And the reason for that is each has its difficulties. For instance, in the we're going to start with the university degrees, pursuing the university degrees, and then we're going to go into practicing dentistry, which I'm not really too certain about because I myself am not an official dentist just yet. So from the point of view of the comparison, it will be studying the actual coursework. So medicine, as you know, in the Caribbean and in the UK is 5 years, and in the Caribbean for dentistry is 5 years. Both courses are about the same thing, 5 years each. Um, they are just as competitive to get into for both courses. Dentistry in the Caribbean and in the UK, most of the courses for the first and the second years are covered by both dentistry and medicine, so they share first and second year courses. Dentistry, however, goes into their dental courses in their third year, while medicine goes into the rotations in some universities into their third years, some in their fourth and fifth years. Now, with dentistry, they don't do call. So, from the point of view of medicine, medicine gets the the edge in terms of being more difficult from that point of view, where in terms of you being in the hospital, it's longer hours. Dentistry, however, has more quizzes. So it means that you don't have as many periods of time of break away from active preparation for a quiz. For instance, when I was in medical school, every 6 to 8 weeks we would have a quiz. Dentistry, you have a quiz every week, at least one. Well, not even one, at least three. So you're doing three quizzes per week versus dentist medical school where you have a continuous assessment where you're graded on your performance on the ward, and then afterwards at the 8 week mark you're given a test and an OSCE. While in dentistry you can have a quiz every day for a week, and then you can also have a practical. You can have a viva, and you can even have a lab. So you have to deal with labs as well as a viva, as well as OSCEs, as well as a written test. Um, Medicine doesn't have so many labs except for like anatomy and biochemistry. We did do some dissections. Not really too certain if it was. I don't remember going into in fourth and fifth doing any labs in fourth and fifth year. Pathology, no. Dentistry, I think you have labs straight up to fifth year. I'm in third year now, and you have labs. I've seen the fourth and fifth years doing labs with dentures straight up to fifth year. So labs don't give usually don't you don't have enough time to finish off your procedures or your um, prosthesis or whatever you're making in the lab during that time that you're allocated for the lab. So you have to do it in your own spare time or your own free time. Medicine, however, for instance, my first rotation in medical school when I was in fourth year was gynecology, obstetrics and gynecology, and the first call I did, we stood in the hospital till about midnight. When we had to do deliveries, so you have to do about 5 deliveries. That was a challenge because when you do those 5 deliveries, you have to stay in hospital till that lady gives birth. So that sometimes you can go straight to 6 in the morning, and then try to freshen up to come to ward rounds at 7 in the morning. While dentistry starts 8 o'clock most days. I haven't been to any earlier courses, but I'm certain I'll be surprised at some point in time down the road. Um, Hardest rotations for medical school, I would probably have said internal medicine. And the reason for that, the number of patients you see on call, um, it was such a high volume rotation where we saw maybe 60 patients being admitted to a ward or multiple wards all over the hospital because the wards were filled so quickly. Um, from that point of view, medicine takes that. Dentistry, however, just the precision required for dentistry for undergraduate degree. We have a lecturer that always says doctors work in centimeters and inches, dentists work in millimeters, and that's not a lie at all. Because up to yesterday, we did a procedure, a preparation for class two. Is it class two? Cavity prep. We have to remove the cavity and then prepare the cavity for filling. When you're looking on the simulator, it's a millimeter, but it's so that millimeter looks so huge on the screen, but it's really just a oomph more, like a little movement of the drill, and you hear bing, and the cavity is removed. From that point of view, dentistry in terms of its precision can't beat dentistry in its precision. I actually am understanding more and more and more why oral and maxillofacial pathology, oral maxillofacial surgery, sorry, requires you to have a dental degree. I don't think there are many courses in medicine or many surgical specialties in medicine that require millimeters. Probably neurosurgery and vascular surgery. What else? Oh, and spine surgery. Probably those three are the main ones that I know that everything is so microscopic. Oh, and ophthalmology. So how could I forget ophthalmology? Where the sutures are so small you can't even see the sutures. You have to use a microscope to see the sutures. So, is dentistry harder than medicine? Or is medicine harder than dentistry? I think they're tied, and that's just it. I think they're tied in terms of their difficulty, and that's because they each have their pros and their cons. And the cons of medicine, long hours. A lot of the times you're on the wards. You have to deal with a lot more fluids than in dentistry. So you're dealing with feces, urine, saliva, blood. Patients are a little bit more combative, especially if they have delirium, although in dentistry you deal with that as well too. Longer hours, so less time to study in medicine. Dentistry, you have shorter hours but more quizzes, so you have to study more often for a set quiz. Granted, in medicine you still have to study because you have to be prepared for ward rounds. But in dentistry, you have to be prepared for an active graded test as opposed to being shamed on the ward rounds if you don't know the answer to a question. Another thing someone pointed out to me, my colleague yesterday pointed out to me that, for instance, when I was in first year for medical school, we did two main courses, which had separate parts. So they had anatomy, biochemistry, physiology within the actual course, but the actual main course was only one course. Well, it's only two courses, and then we did the end of that test at the end of the year. Well, at the end of the first year. In dental school, you do maybe 8 courses. You can start one of those courses 4 weeks prior to the final exam, and you have to do those 8 exams. So we have 21 days, from the 4th to the 21st, that's 17 days. 17 days of exams. One break, and then the weekends, of course, were breaks. While in medical school, we had like 1 week of exams. 4 exams in 1 week, 4 exams in 5 days. Big exams, but 4 exams. So that in itself was a bit, is a big change. Pass mark in dentistry in some courses, not all. Some courses are graded on a curve. Medical school as well too, but some courses have a set pass mark. You have to get above 75. That's a wrap. Medical school, not so much. So medical school, it's graded on a curve, but you still have to get above, I think it's 50 and above. I refuse to say that either is harder than the other. I've gained a lot of respect for dentists because just the coursework alone will drive you crazy. Well, not crazy, but in a bad way, but it's a lot to handle. It's a lot to handle. And there's a reason why both courses are the same price, because for one, when a dentist graduates and goes and does, if for instance they do general dentistry, they're actually making more money than a family physician. And the reason for that is that a dentist, when they're finished dental school, they actually are able to do procedures, surgical procedures. A doctor still has to go on and do training to do any form of surgical procedure, except if they're going to remove lumps and bumps, like for instance lipomas. So from that point of view, is the dental degree worth more than the medical degree? From reading for the 5-year degree, I would actually say the dental degree is worth more than the medical degree. I know I'm going to get a lot of flack for that, but dental degree is worth more than the medical degree. However, once the doctor specializes, I would say that the doctor surpasses the dentist in terms of the worth of the degree. But if you look at just the 5 years both spent in medical school and dental school, dentistry, hands down, they do much better. Hope this helps if you're trying to make a decision as to whether to choose dentistry or medicine. I would say whatever your heart wants to do, just do it. Don't do it for money. Um, Both are difficult. Both have their pros. Both have their cons. Hope this helps. Signing off.